Good morning once again, and congratulations for the organizers for this webinar. I'm working in the Department of Mental Health in the Ministry of Social Affairs, and my task today is just to give you a brief overview about the mental health strategy we are following in Estonia. Just a bit of the background for those who are from some other countries. Estonia is quite a small country in population, and as with going on with the many trends all over the world, quite many people live in the capital of Tallinn, which means that the overall country is with low density of population. And that is also something that influences how we should look at our services and support structures, and maybe also about the health workforce. This is something that is a challenge for our system as well, and maybe the main challenge has been the low number of psychiatrists, especially for children. But of course, there are other challenges as well. We, as other countries, we follow the pyramid of mental health service organization, but the last reports have said that the pyramid of Estonian mental health services is shaped like an hourglass. So people try to cope using self-care techniques, and if that fails, they turn to a psychiatrist or clinical psychologist without first seeking help from the community or the primary level. So in our work, the focus is quite a lot on how to develop the middle layers of the pyramid, informal community support, and primary care mental health services together with formal community-based services, so that our pyramid will really look not as an hourglass, but really as a pyramid. So we struggle with insufficient prevention and community support. At the same time, high mental health needs are growing, and we do have workforce shortages. The overall mental health strategy in Estonia is built also on different layers. In Estonia, we do have a national umbrella strategy, Estonia 2035. It brings together main objectives of developmental activities and indicators for success for the overall country. And then different sections, policy sectors have their own policy plans. For us, the main is National Health Plan for 2020 to 2030. Which also covers mental health and is especially linked to objectives related to promotion of healthy choices. And from that strategical plan, we do have a program that is looked over every year, Health Supporting Choices program, and which sets more specific targets and the base for monitoring how successful we are with the activities that need to be done. But at the same time, we do have a mental health action plan, which describes main activities that need to be done, and also some specific action plans, for example, for stepped care, suicide prevention, and for example, also we do have recommendations for improving mental health of children and youth, for which we have also described different activities. Just to go more specific on what is in our agenda in the Ministry of Social Affairs and the Department of Mental Health, we need to look in the Mental Health Action Plan, and the main areas are policy development, innovation, promotion, prevention and self-help, community support, mental health services, and crisis preparedness. So the Mental Health Action Plan itself is not agreed by the government, but it outlines the expected changes in the field agreed with stakeholders, and in particular the actions of the Ministry of Social Affairs for the upcoming years. For us, the current focus is areas developing a mental health stepped care model based in the examples of United Kingdom and Finland, and it focuses on anxiety and depression. Estonia is starting to use the mental health in all policies approach, which I will describe in a few seconds. And as mentioned before, we really see the need to strengthen the community level support. And we are participating in joint action PRISM in order to adapt Circle of Friends intervention, which is meant for elderly and especially elderly who fight loneliness, and ABC intervention, which is for youth. But what we have seen in our work is that mental health is not just the question of health sector, but mental health is created where people live, work and play. And this is where the mental health in all policies approach comes into focus. Mental health in all policy is a way of working, and it brings together policymakers from various sectors. Its aim is to consider social determinants of mental health by developing, implementing, and promoting policies across sectors that reduce risk factors and enhance protective factors. So it promotes collaboration towards outcomes that benefit both mental health and other policy areas, and striving for win-win results. It means that we, in the health sector, we look for partners working in other sectors and their own sectoral strategies to find out what kind of objectives could be these win-win objectives. We know that if sectors in culture, but also educational initiatives, they take their focus into mental health as well, together with us, we can have much bigger results. But these processes, they need dedication, they need time, financial investment, and high-level long-term political commitment. So to ensure that mental health remains a priority across different sectors. And just this colored scheme that you can follow, it shows like a methodological basis on how mental health in all policies approached. It seems that first we need to look at the landscape on the whole, where are different protective factors and and the risk factors in all across different sectors. We have to assess the landscape and find out where are these possible win-win possibilities and possible results that we can win. Where are connections between different sectors? But at the same time, we need to work with capacity building so that we can use common language across the sectors. We have to work with governance and accountability and strengthen structures and cross-sectoral collaboration so that mental health in all policies can actually work. And it is also a lot about evaluation and monitoring, so that we can have this common objectives, and we can also assess the steps that we have taken. So this was a brief introduction on how we see the mental health strategy in Estonia. And we do believe that this arts in prescription, they do have a quite important part in following the approach of mental health in all policies, and uniting different sectors for common aim.